Welcome back to Psychedelic Therapy Frontiers, the podcast devoted to exploring psychedelic medicine, mental health, and the keys to a life well lived. I'm clinical psychologist Dr. Steve Thayer, and today my co-host Dr. Reid Robison and I are joined for the second time on the podcast by Dr. Paul Thielking. Paul is a psychiatrist, Zen practitioner, and the chief scientific officer at Novamind. In this episode, we dive deep into the world of Zen and discuss how it, among other contemplative practices, has been so important for each of us in our own mental health and spiritual wellness journeys. We also discuss how teaching contemplative practices, particularly mindfulness, to our clients has been pivotal in helping them integrate psychedelic medicine experiences into their daily lives. Quick note, if you'd like to get in contact with us, you can email us at psychfrontiers@novamind.ca. If you have suggestions for topics you'd like us to cover or guests that you'd like us to talk to, have a conversation with, please send us an email. Please enjoy the show today. All right, welcome back to another exciting episode of Psychedelic Therapy Frontiers. Dr. Reid Robison and I are joined again by Dr. Paul Thielking. Paul, for the folks who didn't hear you on your first appearance on the podcast, do you want to give a brief introduction? Tell us who you are.
Sure, yeah, and thanks for having me back.
Yeah.
So I'm Paul Thielking. I'm a psychiatrist, palliative care physician. I'm the chief scientific officer at Novamind. And in addition to that, something that might be relevant for this session today, I'm a long-term Zen student. So I've got 20 plus years of Zen practice, under the guidance of a teacher.
I'm excited to learn about Zen from you. Zen is something that I have a budding, brand new interest in. So I'm looking forward to this conversation. Today, we thought we might explore the topic of psychedelics, mindfulness, and contemplative practices. How those things play well together, why we think mindfulness in particular, but contemplative practices generally lend themselves well to the work that we do as therapists with psychedelics, but the work any of you might be doing, guides, healers, or just your own personal work with psychedelics. So I guess maybe a good place to start, gentlemen, would be to have a conversation about what we mean by contemplative practice. What's a contemplative practice?
Do you want to
I'll try. Yeah, sure, I'll try.
Quiz show with Dr. Thayer. Yeah.
When I think about contemplative practices, I guess my mind goes to Eastern spiritual traditions. Buddhism is the one I'm most familiar with. Hinduism, yogic practices. There's a variety of spiritual paths and traditions that come from the East that you could probably call contemplative traditions. Mm-hmm. There are also versions of contemplative practices in Western spiritual traditions. I'm just thinking about different kinds of contemplative prayer, for example. Mm-hmm. So, it's a little broader maybe than just Eastern spiritual traditions, but that's what I think of first, Eastern spiritual traditions.
We could probably, like Paul's saying, expand that to include any ways of communing with the divine, of tuning into whatever your spirituality is, whether it be a drum circle as a group or an ecstatic dance experience or a personal or group sitting meditative practice. I think the list is quite long when we get into what it could include.
I think I need to update my pronunciation from contemplative to contemplative.
I don't know. I might be totally saying it wrong.
I'll default. I like it, contemplative. And, for anybody for whom the word spiritual is a little triggering, like we like to say, triggers are friends to follow. We would encourage you to investigate that. But
let's talk about it.
Yeah. It doesn't necessarily, spiritual doesn't have to mean religious, remember. But contemplative or contemplative can be secular, right? It could just mean simply a practice that elicits, promotes, or supports contemplation, thinking deeply, reflecting with directed attention, which sort of walks us into mindfulness. Maybe we don't want to go there quite yet. Anything else to say about contemplative?
If you go
practices?
to Google, like they have this program, say you work at Google, they have a program focused on meditation, mindfulness, and other practices like this, and they'll call them inner engineering practices, or exploring your inner self, your inner world, and your place in the universe.
Yeah, that's a very Western thing to rebrand something for comfort.
Yep.
I like it. If it gets more people doing these things, sweet. I remember in the military when we were trying to teach basically meditation, mindfulness to warfighters. What did we call it? Tactical breathing was what we called mindfulness.
Yeah. Well, we are, I'm very hesitant to use the word spiritual whenever I'm in, my medical community, right? With patients or colleagues. It just is such a charged word, and it means different things to different people. So in general, I avoid that term most of the time. I guess we introduced it here at the outset of this conversation, but yeah, it's something people react to, and it can mean so many different things or have so many different connotations. I think we have to be mindful or thoughtful about how we throw it around.
How do you approach it? Do you use that contemplative practice as some kind of alternative, or is there another way?
Sort of like contemplation or inquiry, or just looking at what's most meaningful or important in our lives, examining what gives our lives purpose, meaning, our deepest sense of connectedness, like those kinds of things.
Yeah, and that type of stuff that you're describing doesn't necessitate the presence of a divine entity necessarily. Like Reid brought up the phrase "the divine." That's a pretty broad. That's a pretty broad term and broad on purpose, right? For some people, the divine is God, nature, right? It could be their highest self. It could be a moral purpose. You can worship science if you want to. Doesn't even have to involve worship. It can involve exploration and experimentation.
So we've talked about spirituality on here before, and looked at how Freud and others back then threw the spiritual kind of baby out with the bathwater in some of the psychoanalytic approaches. And it's interesting to look at what's emerged or how it's evolved since then. And I think the world is opening back up to that term and having a much broader definition currently, and psychedelics, I think, play a role in that. But when I was working at Center for Change, the founder, one of my mentors and dear friends, Mike Barrett, who's well known for his contributions to the role of spirituality in psychology, especially eating disorders. In fact, there's a textbook on my shelf over there that he co-wrote called Spirituality and Eating Disorder Treatment. But he told me once of a conference he went to with colleagues presenting on spirituality 20 years ago or so, where they were almost booed off the stage. But fast forward till now, and it's I took over the spirituality group at Center for Change for him and had that same hesitancy about the term or fear, but I do think there's a way to navigate it with the right preamble, and there's a huge potential benefit for whatever you call it, bringing that search for meaning, that purpose, that personal spirituality into the course of treatment, can have huge benefits.
Yeah. Sometimes I think that mindfulness as a third wave psychotherapy was a way to smuggle spirituality back in.
Yeah.
just because I think in our efforts to be like one of the other sciences, psychological science tried really hard to operationalize what it means to be human so that we could study it, right? Love is these things, and we get at those things by asking these questions on this questionnaire, observing these behaviors in a lab, or looking at these phenomena on an fMRI. And it took the spirit out of the human, and left something to be desired, I think.
And you couldn't say love either. It was like Carl Rogers would say, unconditional positive regard.
Yeah, leave it to a psychologist to come up with 3 words to describe one thing.
Yeah.
Fancy terminology.
Well, it brings up a couple of things for me. One is just looking at mindfulness and how it's, mindfulness is something that pretty much anybody you walk into on the street nowadays would be familiar with, or at least heard of, right? It's become part of our
They got
culture
trained in their corporate.
Right?
Their last corporate mental health update was, you guys need to be more mindful. They've definitely been exposed to it.
Yeah, so it got packaged in this Western medicalized way that makes sense and makes it accessible, right, here in the West. I was just thinking also that now we have this, with the psychedelic renaissance, we have the mystical experience that's become, something that is associated with positive outcomes that we see in studies with psilocybin, for example. And so the mystical experience is maybe a way that we're packaging whatever we're getting at, maybe when we talk about spiritual, in a way that scientists and Western medical people can, grasp or not automatically reject.
Yeah, again, calling it that helps us operationalize it. What is the mystical experience? What are the characteristics of the mystical experience, right? They're a sense of awe, a sense of there being part of a greater whole, a sense of there being some kind of directing force or energy or divine out there. These are the things that were the purview of religion, and now we're saying are important aspects of a person's mental health. And so again, we kind of smuggle it back into psychological science, and if we're going to treat people's mental illnesses and these things, a connection to the divine or a mystical type experience under the influence of psilocybin, can address somebody's depression or their sense of loneliness or their anxiety and worry and existential dread, then all the better.
Yeah, who would have thought that we would be using medicines to occasion mystical experience for the treatment of mental health conditions? If you would have said that 10 years ago, I wouldn't believe it, that would come back. I know the literature's been there for a while, thanks to the 60s and the original psychedelic golden era. But yeah, it's fascinating that when struggling with whether it's end-of-life anxiety or severe depression, that you can give, say, psilocybin and at a certain dose predictably occasion in 70 to 80% of people one of the most profound mystical experiences of their lives, and how that is quite therapeutic.
And apparently it's been part of, the coming of age ceremonies or the treatment of physical, mental, psychospiritual illness in other cultures for thousands of years, from what we can tell. So this, perhaps using a substance, has been part of the human animal's attempt to get well for a lot longer than modern Western society has been playing around with it.
Yeah, and just thinking about mindfulness or the mystical experience and how it's now maybe being presented in a way that makes it accessible, right, or to lots of people. There's pluses and minuses to that, right? So that's an interesting question to look at too. Like mindfulness, for example, being, presented as something that can just, help you feel less stressed and maybe improve the way you function, like at work, right? And that's quite different than maybe the way that it's occupied like a central role in a lot of spiritual traditions, where it's really part of a spiritual life or a spiritual orientation or daily practice is mindfulness. So it becomes more limited maybe, and perhaps you could say the same thing about psilocybin. We're using it in the West in mainstream medicine now as something to relieve symptoms, and the mystical experience is associated with that reduction in symptoms, but I think the thing that makes it accessible to a lot of people is more just the fact that it can help you feel less depressed and less anxious. Right?
Yeah, that might be what's bringing it back, but I agree. I see a much bigger purpose and bigger origin than that of, raising consciousness, or what can it do for the betterment of society beyond just helping heal the ill.
Right. So maybe there's a lot more potential here, right, with psychedelics. We just got to start somewhere, unless they're going to stay underground.
Yeah.
So you start with bringing them in as a medicine, in the medical model, and then maybe from there they have an expanded role, right, and they become part of just anybody's self explorations, development, right, consciousness,
tools that might help on one's path.
Yeah. So it's just not about reducing pathology, right? Yeah.
And I'm curious, you mentioned some of the aspects of watered down mindfulness that exist around here, but I'm curious, Paul, what your perspective is as a 20 plus year Zen student, like how you got into it or how you view mindfulness through that lens.
Yeah, well, I'll try to speak to that. I guess, first of all, I've been a Zen student, Zen practitioner for a long time, but I've had interest in mindfulness that predates that, and have a lot of experience with introducing mindfulness, like in my role as a therapist and psychiatrist. So, in Zen, at least in the tradition I've learned, we don't really talk about mindfulness, actually. We do sitting practice, and a lot of the techniques might be the same as you would do in mindfulness practice, right? You start by learning to follow your breath or count your breath. But I think in Zen so in mindful practice, there's you sitting there being mindful of something, like paying attention, being aware. So there's there can be like a duality there, like somebody that's observing and something there to be observed. And I think in Zen, a lot of the point is to try to go beyond that dualistic notion. So it's being mindful, but then looking at, well, who is it that's like watching the breath or counting the breath, or who is it that's aware of, what's going on? So I think it goes a little beyond mindfulness in a way. So I don't know if I'm getting at your question.
Yeah.
I forgot what your question was.
Well, Paul, I'm interested by this. So the idea, when you're trying to get away from get away from the duality of mindfulness, like you said, that there is a looker and the things where the looker is looking at, and you're trying to transcend that so that all there is consciousness. Everything is this broad container that is consciousness. Because this is a trippy concept that a lot of people, myself included, struggle to wrap my head around. As I'm meditating, let me back up. So in my mind, mindfulness is non-judgmental awareness of the contents of consciousness, right? Whatever shows up, whether it's a physical sensation, a thought, an emotion, a sound, like it's all to be observed without judgment, without attachment to control or direct.
All the present moment stuff.
Right. But still that implies that duality you're talking about, Paul, where I am, whatever I is, whatever the self is, am the one observing the contents of consciousness. So what I hear you saying, this next step or this other level in Zen practice is to transcend that duality to where there is no observer and observed. So what is it then? If it's not observer and observed, is it just...
So that's the question, right? Like, so who is that I that's observing? What is that, or who is that, or what? You penetrate deeply into that question. What is it?
And speaking of the questions, is that where I've heard of the Koan?
So
being part of
that
Zen,
could
just
be
contemplating questions that are frustrating.
So that's a good example
Triggers.
of what we could call a koan, right? Which is a question that you just can't answer with your conceptual mind. So you're asking this question, well, what is that I? And that's the question, right? Is there an answer to that? Like, I can't give you a conceptual answer to that that's going to satisfy you, probably, right?
It's the answer moo.
But it could be moo. Like, I could say moo, right? That's a classic koan.
Right.
Does a dog have Buddha nature? And the teacher Joshu says moo, which means no, but it's really more of like just a negation, right? Like not, and then the question is, well, what is moo? And that's the first koan that a lot of people get in Zen.
MU,
moo. Like, what is moo? And people can sit with that koan for years, right?
Yeah, talk about contemplative.
And at some point, like, a lot of people, they get it. Like, they get the answer, like on a deep sort of way, like in their bones, they get the answer. But it's nothing like, if I told you an answer or explained it to you, like, it wouldn't really have any meaning, right? So a koan is something you penetrate, like, in that sort of way where there is an answer, but it's not a conceptual answer. It's not an answer even like your dualistic mind, can grasp.
And that grants you some kind of freedom that we don't experience when we are sort of just lost in thought.
Liberation, right? From our conditioned state, right? Or from
we are
suffering.
Being jerked around every millisecond of the day by our conditioning, like you said, by our environment, just by whatever it means to have this meat suit on that we call the human body. Like, and from what I understand, these contemplative practices, especially mindfulness, is to transcend our attachments to all those things. I might be experiencing annoyance at this koan, but that's just another thing to perceive. It's another thing to watch. Like, oh, Steve is feeling annoyance. Fascinating. And as I have worked with my clients on using mindfulness for the treatment of their mental health issues, at least one of the tools, like Reid mentioned, that's a continual challenge. Like, I can practice it in a meditation practice, but how do I use it? How do I use it day to day? I don't want to detract too much from what you're talking about with Zen, but that's a question I have in my mind that a lot of my clients do as well.
How do you use what day to day?
This mindfulness phenomenon that we're saying will grant you all this freedom. It's not the way our minds work most of the time, though. And I guess I'll pose it as a question to you, Paul. Being a student of Zen for as long as you have, do you feel like you walk around in a state of blissful, meditative, mindful awareness? Or do you feel like still jerked around, like I was saying before, by everything that makes you human?
That's a tricky question to ask. So what I would say is maybe what's different now than when I started Zen practice is it's more just about really just living life naturally and not being so like caring or preoccupied with what my experience is, or what, not analyzing it, not picking it apart. In a way, it's almost being oftentimes kind of mindless, just going about life, right? Just being one with daily life, whatever it is. Picking up the garbage, washing the dishes, going to work, like just being really one with that,
Right.
And to bring in the Western scientific interpretation of that, even though I can see the dangers of that, there's this growing body of literature around benefits of mindfulness and mindfulness as one of the greatest change agents. And there was this seminal paper back, I don't know, it's been years ago now, on the default mode network, and it was titled "A Wandering Mind is an Unhappy Mind," and it said that 47% of the time our minds are wandering. That's when our default mode network, say the neurobiological seat of the ego, is more active. And that watchtower, that's the stories, the future tripping, the rehashing the past. But then when that's toned down, like Paul is saying, in more of a mindless state, you're more present for how life is unfolding. And life really only unfolds in the present moment, the here and now. If we let ourselves, our monkey minds, pull us into the future or the past, then we've shrunk our life, our sense of, our ability to live fully, which only happens here, which only happens through the body beyond that monkey mind, or that complete sensory experience.
Yeah, I think I like what you're saying, Reid, and it's helping me just clarify, my response to the question. It is maybe more about like just being fully immersed in whatever it is that's unfolding moment to moment and not resisting, even if it's painful, even if it's sad, even if just not resisting, just being really open to all of it, like no matter what, like completely, like unconditionally accepting and not resisting.
Yeah. Do you have a sense for, or maybe you could describe the difference between resisting and not resisting what is unfolding in the present moment?
Well,
what does that look like?
I mean, what comes up, I guess, is thinking about suffering, right? So I've been working in a cancer hospital for a long time. You get cancer, most people have pain, physical pain of some sort. It just goes hand in hand, right? And that's part of the experience. A lot of times other layers get added on to that experience of physical pain, like we don't like it, we clamp down, we try to push it away, we get preoccupied with it, we get depressed, we get anxious about it, we judge it, we try to escape it, there's like all this other stuff that gets added on to the pain. So in a way you could say that's like all the extra suffering that we layer on top of just that experience of being in pain, like, ow, my leg really hurts, it's like all these other layers of suffering. So that's just like an example, maybe that gets at what you're talking about.
So at any moment we are not free to not be in pain, because that's an effect of something that's happening in our body to our nervous system, but we are free to drop the suffering. Potentially? Yeah,
if you define, which I like to do, define things as, there's pain that is inevitable, but suffering we have control of. It includes our emotional reaction to pain. It includes our resistance that makes things persist sometimes. And that we can address with mindfulness type practices. Mm-hmm. Because, a mindfulness path is this gradual process of learning to be more present, sitting with difficulty, discomfort, sitting with even pain, and not fighting with them so much, not pushing them away. So eventually they can just pass. They can just flow through without that big fight against ourselves.
Yeah, I'm not trying to be too obnoxious with my questions, just a little obnoxious.
Yeah.
I know that for some of our listeners,
They're good questions.
you know, the idea of just be present with it, that's your problem. They're like, you know, double birds, screw
Yep.
you guys. I don't want to be anxious anymore. I want to be happy. I've been told you can give me a pill that will make me so. Why do I want to be present in the moment? Why? How is that better? Why is that better? And, you know, I've heard, maybe I've even already said it on the recording, but if I didn't, I've heard Sam Harris say that if you distill or boil mindfulness down just to a tool to feel happier, you're missing the point. I think, Paul, you kind of referencing that earlier. It's more than that. It can be a lens through which you approach everything in life that can set you free from a lot of the suffering that, Reid, you're making the distinction between, right? Pain versus suffering.
Yeah, no, I see the point, the question of like, why would I want to be more present for pain? But the thing is, there's there are two sides to the coin in life. You know, there isn't the pleasure without the pain, and you know, you can't just have a pain-free existence. It's part of life, and we make it more painful by fighting against it.
Yeah. And there's something I think that can come from, you know, having a practice, like a mindfulness practice, where you know, even if it's pain that you're aware of, because that's your present experience, you practice just being with that, and over time there's an equanimity, or almost sort of a being just more at peace or more okay with life as it is, even if it's often painful, you know. And so it's not necessarily like about escaping, you know, like pain, because it's part of life, like Reid was saying. But we get maybe to a point where we just, our orientation towards it is different, or there's more like spaciousness there or something, right? So it's not so overwhelming or all-consuming. I don't know if that makes sense or not.
It does, yeah.
Yeah.
So this state of equanimity and this openness, is it compatible with having goals? Is it compatible with, because you hear non-striving being part of, you know, that mindfulness state. Well, if I'm in this state of non-striving and the dishes need to be done, do I still do them? If I want to make more money, do I still try? Like, is it compatible or incompatible, do you think?
So if you look at the early roots of Buddhism, like the Taoist philosophies, that there's this like unseen river flowing underneath us, and that's the direction of your life. And you know, the more you create space for stillness, and the more these contemplative practices you do and open up to that and tune into that, then you can ride it like the lazy river of your life, and you can steer it in a direction, like with intentions that are consistent with, you know, with your life and its course, and your strengths and values, and, you know, your truth. And you can alter that course, but if you start fighting against it, like swimming upstream, you're not likely to get anywhere. I see that more as like the striving approach, is like, no, I wanted to be this, or I want everything to be different. That's the less productive approach than like tuning into it and playing to like the true nature of things, with whatever you know, kind of gentle influence you can have on it. But I don't know, what do you think, Paul?
Well, a few things came up for me. One was, and I'm sorry, I don't remember like the name of this accomplished master. Somebody in India, you know, had basically achieved this, say, being the embodiment of like unconditional love and compassion, let's say, some kind of a guru, right? And, I read this account of how they basically couldn't function, right? They walked around with this beaming sort of overflowing, boundless compassion, but, had to be like carried around and didn't even do anything for themselves, like, because they were in this state, right? And just totally inhabited that state. So I think you can get into these states that become pretty non-functional, right? In my path that I am on with my teacher, and like that is like what the striving's for, is getting to the mountaintop, let's say, but then you come back down like into the world and you just function as a ordinary human being. And so there's striving and there's all different kinds of emotions, but you choose to come back into that. So it's not like it's not about escaping all that, although it can be for some people like that. That's what a spiritual practice can become, is trying to escape. But it's more about after having had some liberation, let's say, it's just choosing to come back, into the muck, into being a human being.
And chopping wood, carrying water.
And when appropriate, striving, and when you don't need to, then not striving, and being comfortable either way. So it's not picking and choosing, in fact, there's a Zen story about like what's the way, and the way is not picking and choosing. It's as simple as that.
So non-striving, non-attachment doesn't necessarily mean non-doing.
Yeah. Another way of looking at it, is it's just one side of the coin. So yeah, we have non-striving, and that's a state of being free, right? But that doesn't work so well in life, in daily life. That doesn't work so well necessarily, right? If you have, let's say, in my case, like I've got kids and I need to make an income and this and that. So sometimes I strive, but that's okay too. Just the other side of the coin.
There was a teacher I had in the past who asked a really kind of profound question of, how much ego do you need? And the answer that came out of that was just enough so you don't get hit by a bus. Like, it's that idea of, formlessness is great, but you also need to take care of day-to-day life and go pick up your kids or get to work on time. And that is a thing in some of these approaches. It reminds me of like the psychedelic experience. You're not going to get a whole lot accomplished as far as your life goals or duties goes at the peak of a psychedelic experience, but you come, or as Jack Kornfield says, after ecstasy, the laundry. Like, you come back down and you have to inhabit both places, like be in the world, not of the world, be form and formless at the same time.
Yeah. So another term that I like is free functioning. You function freely. You function freely in the world.
Free from what?
You're not stuck.
Free from conditioning, free from
conditioning,
self-defeating narratives,
free from being narrowly identified as this body and self.
Stuck in the eye.
In a way, you could say a lot of this boils down to being identified with the self.
Which is a great segue to psychedelics, right? Like, why are these contemplative practices and the concept of mindfulness often used as integration tools, integration practices for people who have experienced psychedelics? Because psychedelics, depending on the medicine, depending on the dose, often result in, oneness with everything. They result in feelings or experiences of awe and connection. They result in the dissolution of ego and self. and a change in priorities. They bring you into the present moment. I remember the first time I ever experienced psilocybin, I was like, oh, this is mindfulness. This is what I've been telling people is my mindfulness. Yeah. And I had experienced maybe a flake of it, maybe a sliver of it in my own contemplative practices, meditation, prayer, being in flow, doing extreme sports, things like that. But it wasn't until I had that psilocybin experience that I was like, holy crap.
It opens the door. It shows you that state. And then the contemplative practices are how you walk that path or how you work on embodying that more and more. They say that meditation is the tried and tested course, and psychedelics are the crash course or the buffet. And so I think it's not that psychedelics are the answer and contemplative practices are what you do after. It's like, contemplative practices are the path, and psychedelics are, signposts or accelerators along the way.
Yeah, and I think this is true. Like, I don't know if I have data to support it, but I think a lot of Westerners that got into Zen and other contemplative practices, like from the East, that had come back in the 60s and 70s, like a lot of them had psychedelics as their the thing that opened the door, right, yeah, to their curiosity, or they had experiences with psychedelics that they couldn't explain or there wasn't a container for, and kind of led them, into some kind of a practice, some kind of a spiritual practice.
Like the Beatles. I went out to the Beatles ashram in Rishikesh, India, where they were told, okay, you're done with LSD now. They loved LSD so much they used to store a big stash of it buried underneath the ground in their backyard. But just like Ram Dass in his journey to India, when Maharaji kind of helped him see, you don't need these anymore. And like Alan Watts said, when you get the message, hang up the phone.
Yeah. I have a friend, like literally a friend, like that I just was talking to a couple days ago, who was telling me about doing ayahuasca recently for the first time, and how ever since that experience, like he's just meditating every day. And he used to try to meditate and hated it because he would always feel like he wasn't doing it right, get super judgmental, and was never able to stick with it. And after his experience, I think kind of like you're describing, Steve, like, wow, this is like what it's really about. Like, this is like what sitting is, or mindfulness is. Like, he's just doing it, spontaneously, like on a daily basis now, and enjoying it.
Yeah, so one of the reasons I asked the question about the non-striving and goal setting is I think Westerners, especially in America, we have this ethos of pick yourself up by your bootstraps, make your life what you want it to be, set goals, strive for change. And there's a shadow side to all that of like, I'm not good enough unless I'm achieving these certain goals. I'm comparing myself to other people all the time. And that's the context I grew up in, a striver, an achiever, needed to be a straight A student, needed to be on student government, needed to be a star athlete, needed to be a good musician, needed to blah, 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 right? And then I think you have people like that who experience psychedelics, and it is a freaking paradigm shift. And sometimes can be a very productive paradigm shift, but my own personal experience with meditation was that of your friends. Early on, I was like, this is freaking boring. I'm not, quote unquote, doing it right. I can't figure it out. I don't feel relaxed. I feel more anxious after I meditate. What's going on? And then, maybe it's just for people with a personality like mine, psychedelics put me in that place. And maybe I had to be put in that place and shown, like Reid was saying, the signpost. Like, okay, now that I've experienced it, I can make a mental bookmark. Like I often say, drop breadcrumbs on my way out of that experience so that I can find a way back. But finding my way back is the practice. It's the daily practice of meditation. It's not, microdosing or taking LSD every day.
It makes me think of the sport of golf, just because I grew up golfing, and people almost universally hate it when they try it their first time or two because there's such a learning curve. And I've seen a lot of similarities in the 1 million people who've told me I can't meditate because my mind's too active, or I'm too fidgety, too distracted. Hate it. But you've got to do it quite a number of times before you get to the place of even seeing the bliss on the other side of that frustration.
And I must say, I've seen Reid's golf swing, and it's that's a meditative experience itself. Just watching Reid Robison golf, it's a beautiful thing. And if you're telling me that I could golf, that I could learn to golf with enough practice, you can go straight to hell. That's I try every time I try to swing a golf club, it feels like I'm trying to walk for the first time.
Yeah.
Anyway, sorry to derail.
And how many times are we talking about whether we're talking about a meditation practice or golf?
Yeah, that's an excellent question. I certainly, so my experience with psychedelics certainly helped. It was like a level up in my understanding of what meditation was supposed to, quote unquote, supposed to be like. It was a sort of a developmental stair step as opposed to a gradual increase. But it's still, as I think about it, going to take me a lot of time. A lot of repetitions.
Yeah, we're in an ADHD kind of nation, and you could see why psychedelics are so helpful, if not needed, for some people to show them that path or show them the door. Like, in fact, that's why I got into yoga. I was I'd been meditating and teaching meditation for quite some time, and getting more and more frustrated with how hard it was to get someone to sit down in a sitting practice for even just 3 minutes once a day. And then I discovered yoga, and I felt this kind of embodied moving meditation practice that could be a carrot to dangle in front of someone to help them get to that place of sitting still long enough to touch into an enlightenment type place.
Yeah, Reid, can you talk more about yoga and your experience with yoga and how it sort of relates to this topic of contemplative practice? Like the body movement part fascinates me.
Yeah, so they say that when the Buddha kind of left the kingdom to go on a spiritual journey, that part of his path was to do enough kind of movement or yoga to be able to sit still long enough to attain enlightened states. And I can certainly see that the truth in that, or how that's true for many of us, where we don't take care of ourselves, our bodies, and therefore it can get really distracting to sit in meditation practice. That's part of the practice, right? I'm sure Paul can share a story or two on that too. But so yoga, one of the practices I really like in yoga is called Ashtanga yoga, or the 8-limbed path, where it's basically a system, like some types of Zen would be, a system that gives you first these, what they call these yamas and niyamas, the ethical guidelines and the moral kind of values and restraints as the foundation to build on. And then there's the asana. This is just limb number 3 of 8, the yoga movements. But then comes pranayama, the breath work. And then it goes through these limbs all the way to meditation as the 7th limb, where you've done a whole lot of work before you can actually get into a state of meditation. And then the 8th is what's called samadhi, or the state of pure unbounded awareness. So it's this system of, it's this practice or system of living that includes body work, body movement, breath work, kind of honing your concentration, turning inward, meditation on this path to awareness.
Yeah, that end state, like that's I've done a little yoga, and I had heard, that traditionally, like the physical postures, the asana, like that's all just preparation, right, for being able to sit, basically, right? And I think in Zen, for example, maybe just go straight to just the sitting part and skip some of the preliminaries, which has its own like pluses and minuses, right? But it's interesting. It's kind of the same end goal, you could say. And maybe what psychedelics do is give people a glimpse, or some approximate experience. Like, there's all kinds of different experiences you can have on psychedelics, but some kind of a glimpse into that sort of a state of being, right?
Yeah.
And and for some people that might naturally lead them to be more feeling like a need for some kind of a more formal practice or a path. Not for everybody, but I think these contemplative practices and paths, like they do offer that, for those that might have had an opening or a glimpse through psychedelics. They've got some place to go.
Now what?
Next, to continue the process.
Yeah, the now what question I think is pretty common for a lot of us that experience psychedelics.
Now what? And do you just like compartmentalize it and go on with your life, or do you? I suppose some people might have such a transformative experience that their life just changes. But for most people, it's probably, now how do I go back to my regular life, and what does this all mean, and how do I make sense of it and try to carry something forward from what I've experienced? And
I think our field, the mental health field that's involved in this research and this practice, is trying to offer some answers to that question in the form of psychedelic assisted psychotherapy. But it's still a very young science. We're trying to figure out which types of psychotherapy maybe lend themselves best to psychedelic medicine and work with psychedelics. There's also the wisdom in indigenous cultures that have been using psychedelic compounds, plant medicines for many generations, in answer to that question of now what, that I think we can learn from.
Yeah, and what are the practices that support integration? That's why I love the fact that psychedelic-assisted psychotherapies are here, because it highlights the importance of what you do in between your sessions or your medicine doses or your therapy work. Like, something that I think we've all known has been a missing or difficult to implement challenge is, like, what do you do on a day-to-day basis? I really believe we all need something, and that's a personal thing, but we all need a way of just going inward or accessing that stillness or that contemplative place on ideally a daily basis, so we can recalibrate, tune back in, kind of listen to our intuition, and open back up to what's really true for us, or our real self.
And along those lines, maybe it's these practices could be mindfulness, could be yoga. There are probably a bunch of them we could list, but they do maybe offer a way to do a practice or have a routine that I think of it as kind of like building a structure, almost like a container, or a container for these other kinds of experiences, like having a glimpse or an openness that you might have through psychedelics. But it's a way of stabilizing that experience somehow, or some insight or from that experience, so that it just doesn't become like a fleeting experience that doesn't really carry forward in your life. Does that make sense?
It does, because it makes me think of a lot of times we're going about our day-to-day life in anticipation of feeling better, of like accomplishing a goal, or I'll feel better when I talked in our last podcast about climbing this mountain, and I was being thoughtful about why I climb it. Is it so that I can get to the top? I certainly want to get to the top. I'll feel great on the summit, but that great feeling lasts 30 minutes. And what is life about? Life, if you add up all the time spent in the journey that is your life, you spend most of that time journeying, not being at destinations.
You didn't make it to the top.
We didn't. No, actually, this time we didn't.
Yeah.
In coping with that tragedy, I had to kind of ask myself, okay, well, did I fly out here and spend the money and take the time and put forth the effort just to be at the top? And my honest answer is no. It was so that I could climb it. It was so that I could journey. Another insight I had, thanks to magic mushrooms at one point in my life, was that the point of life isn't to arrive at destinations. The point of life is to live. The point of life is to journey. Journey being a verb.
Yeah.
I'm in the process of journeying. And mindfulness, I think, is a wonderful tool to help you wake up from the spell cast by your conditioning or by your desire for pleasure and to avoid pain. And wake up from that to this reality that we've been discussing, that you can access through contemplative practices, that it all just is. And the faster you can just let go, open yourself up, and experience it, the quicker you'll have I'm struggling with this one, a better time of it.
Yeah, it all just is, and it's all happening right now.
Yeah.
And right here, and there's no other place it's ever going to be happening.
Mm-hmm.
I remember when I was a teenager and went on a vacation with some extended family. I was growing up in Ontario, and we went across the border into Michigan, stayed on this lake. Beautiful lake. There were surfboards, I guess windsurfing and sailboats and everything else. It was kind of a dream. And then one of my cousins showed up, an older cousin with a new partner, and they showed up and the weather turned bad. But this guy, he quickly went into this state of, oh no, I just took vacation time from work and it's wasted because this is bad weather. And he was like visibly like frustrated, angry, stewed in a room, angry for days. And that's kind of the opposite of what you're describing.
Yeah, he was captured by his mood,
Yeah, the opposite of mindfulness, or what we would target, or what we would get liberated from in these practices.
Yeah, you don't have to hold happiness hostage while you await circumstances to be just right. You can have access to happiness or joy or peace or whatever, theoretically, from this perspective of mindfulness, at any moment. Even if you're in a terrible mood, you can simply begin again. You might have to do some things to help your nervous system come in alignment with that mood. If I'm in the middle of a panic attack, it's probably hard for me to just be like, you know what, I don't want to be in a panic attack anymore. I'm going to change my mind about that. You might have to do some things like write it out, or breathe slowly, or take your medicine or something like that.
But wouldn't it be cool if you could get to a place where it doesn't matter if you're doing the dishes or sitting on a beach or taking the trash out or climbing a mountain, you can like really feel the beauty of that moment regardless.
That's enlightenment, right? I mean, to some extent. That's and maybe from our perspective as mental health professionals, you could say that that's good mental health.
Yeah, it doesn't mean a beach isn't preferable for a vacation than taking out the trash, right?
Mm-hmm.
But there's a lot we can do to work on, the limitations and conditioning and reactions we have.
Yeah, like Paul was saying, taking out the trash doesn't have to be suffering just because it's not.
Yeah.
It's not something we would choose over going to the beach.
Yeah, and another side of it is that having mindfulness practice and being able to be really present, in the moment with whatever's arising, doesn't make mental health problems go away necessarily, right? It doesn't make anxiety go away. It doesn't erase depression. Like those still might be real problems that a person, struggles with, even if they're a long-time meditation practitioner, right? So it's not necessarily a panacea, a cure-all for all of our ails.
I'm so glad you made that point, Paul.
Yeah.
Because, a lot of people are coming to us because they want their pain and suffering to stop. And understandably, right? I don't freaking love pain and suffering either.
To give you an example, there was this study at the University of Wisconsin a few years back where they looked at expert meditator monks and non-meditator volunteers, and they did some brain imaging and assessed the pain response in other ways. And they would take this heated rod and put it on them, and this is IRB approved, so it must not have been that painful or permanently damaging. But they first saw that the pain response and the reaction of the brain areas of the expert meditator monks was less. But then the next part of the study I found really interesting is they said, okay, in 10 seconds, I'm going to put this hot rod on your skin, and you're going to feel some pain. And the non-meditators, the brain areas of the pain lit up right then. Like before getting the stimulus, the meditating monks did not. Like there was no pain until stimulus was applied, and then there was some pain.
That's fascinating. Yeah, the neuroscience around mindfulness is interesting. There's apparently some evidence that there's like thickening of the cortex in certain areas in experienced meditators. It's a prophylactic against dementia and things like that.
So cortical thickening is another way of talking about neuroplasticity, this idea that neurons that fire together wire together. What you practice kind of becomes your default state. So if you practice loving kindness, that becomes more prevalent in your day-to-day life. It's a beauty of this idea of neuroplasticity, and with mindfulness, we have the chance to practice any moment. And it's fascinating. It's in fact why TMS works, and why we like the neuroplasticity window that psychedelics open up. But I think the most important is how much do we practice this on a day-to-day basis in terms of moving the structure of our brains and the direction of our lives into something more conscious that we would like to will into existence through this kind of practice.
Well, gentlemen, as we wind this thing down, any other thoughts, ideas around mindfulness, psychedelics, contemplative practices that you want to share with our audience?
I wanted to circle back briefly to something we touched on earlier, which is this notion of the self. And I mean, we all have a self, right? And we're probably pretty identified as ourselves. And I think one thing that doing a regular mindfulness practice does is it just allows us to see what it is that we call the self. It's not, in fact, anything very solid or permanent, or fixed. It's like a conglomeration of all kinds of conditioning and ideas and beliefs and memories, right? There's nothing really solid there you can grab onto. And I think with psychedelic experiences, people oftentimes, they kind of see through that, right? They kind of see themselves in a different, from a different perspective that's not so identified with this isolated sort of body, mind, emotions, right? Like you get a broader perspective of who you are, right? Maybe it's more of a, feeling unity with something greater than your limited self. So you it shifts your self identity, or your perspective on the self and what it is. Become less identified with it. And that's like a big shift. If you're going through your life for 20, 40, 50 years identified as a self, like as Paul, And now all of a sudden, like, I'm seeing, wow, like that's not like really who I am, you know, or I'm really much greater than that. Like, that's a big shift. And then how do you come back into day-to-day life, right, and function? And it's like it takes time to kind of figure that out or work with that, you know. And that's where I think a practice can become really important. You have a mindfulness or some other meditation or contemplative practice, and you start seeing through the self, or experiencing that it's not fixed, it's not solid, and it's just easier to go about your daily business not so identified as this limited self.
Yeah.
So I think that's, as we're talking, like, it just strikes me that that's a real core theme here, is like how we see the self, how we relate to ourselves, you know. And so I think psychedelics and contemplative practices can really go hand in hand in a way.
Mm-hmm.
Like, I really do feel like they both have something to offer the other. And I feel like that's part of my path, or what I'm interested in, is trying to kind of figure that out.
Yeah. Man, especially in as much as our relationship to self is an unhealthy one. Like, if I identify very much as Steve, and I happen to have lots of negative beliefs about Steve, and I think Steve's a loser, or I think he's ugly, or he's incompetent, or whatever, then an experience on psychedelics where I get some distance, or that self dissolves, you can imagine could be incredibly healing, or at least has the potential to be healing, especially, as you say, Paul, if you have a daily practice, a contemplative practice, where you are revisiting that insight, or you're trying to rehearse through meditation non-judgmental awareness. You really can see how they really do go hand in hand.
Yeah, then you might just see Steve as, you know, like, you might see all the reasons, like the conditioning or early experiences or whatever that shaped some of those beliefs. And you might just have more self-compassion, right?
Yeah.
Like,
I did have a psychedelic experience once where Steve was a construct. That was really weird. Like, I experienced. At first, I forgot my name. For a while, I was like, I think it's Steve. Steve.
Hey,
that sounds
true ego
weird.
death.
Yeah. It's like, Steve is a and Steve's not a bad guy.
Yeah.
Oh, that was
But maybe Steve's just a construct.
right.
Yeah.
Just like maybe Reid and Paul are just a construct.
Man, blue pill or red pill, Paul? Gosh.
Yeah.
Out of the Matrix.
It highlights to me the need for some support by way of community, mentor, teacher, guide, therapist through the process, because an awakening like that, where you poke some holes in yourself or it gets shattered, that can be extremely healing. It can also be disruptive. It can be both.
Yeah.
And
good point.
and you do need a way of coming back down that mountain and getting back into day-to-day life, where you could be pretty discombobulated.
Yeah, enough to not get hit by a bus, right? Like you were saying earlier. And some people, metaphorically and perhaps literally, after psychedelic experiences, get hit by buses because they haven't been able to knit that ego back together sufficient to carry them through the rest of their life. So yeah, like Paul said before, we don't want to overstate the promise here. Psychedelics are not a panacea, but they have the potential to be a really potent tool.
Yeah, especially
Indeed.
with the right support, guidance, etc. Yeah.
Amen. Aho.
Agreed.
Aho.
Thank you for joining us today. Psychedelic Therapy Frontiers is brought to you by Novamind, a mental health company that specializes in psychedelic medicine and research. You can learn more about Novamind's mission to increase access to legal, safe, and evidence-based psychedelic medicine at novamind.ca. If you like what you heard today, please subscribe to the podcast on whatever platform you're using to listen or watch. Also, if you're feeling generous today, please leave us a glowing review on Apple Podcasts, Stitcher, or wherever you like to listen. This will help us get into the ears and faces of more people and help us put wind in the sails of the psychedelic medicine renaissance. Thanks for listening.